So we're at 2 minutes now. So 1 minute. I will give the last cue at 10 seconds. So, maybe
how many people do you have connected now?
52 now.
62, okay.
52.
52.
Yeah. So I will give a mark at 10 seconds, maybe wait then 20 seconds more to give people time, and then you can start. So 20 seconds now. Good luck. And we're at 10 seconds. 3, 2.
Good afternoon, everybody, and welcome to this co-design session, Cluster 1 on Health. I'm Stefan Schreck of DG Santé. That's probably the first surprise, but DG Santé is co-chairing with DG RTD the design of this Cluster 1 Health. So welcome to the R&I Days and this co-design session on Cluster 1 on Health. I should first explain to you that actually there are in total 2 co-design sessions for Cluster Health, both of them addressing future needs in health. The difference between the session is that the first session, in other words, this session, will focus on the short to medium term measures how research and innovation supported under the health cluster could contribute to the continued response to COVID-19 and help repair the economic and social damage brought by the coronavirus pandemic for the recovery of Europe. The session tomorrow will look at how research and innovation can contribute to the longer-term, sustainable, green and digital social and economic transformation of health and care in Europe. So this session is indeed about the short-term reaction to COVID-19. As we all know, the COVID-19 pandemic has thrown us all into a crisis of unprecedented dimensions, and we are by no means through it yet. This session will invite you to reflect on what short-term to medium-term measures that Europe needs to take in the domain of health research and innovation for a continued response and recovery from the COVID-19 crisis. The idea with this session is that we want to listen to you. So it's basically you answering our questions and we not answering yours. We would like to pick on your brains to gather ideas and opinions on what you think would be best placed to do. So we will ask questions and you will give the answers. Now I'm representing DG Santé. I'm the one of 3 moderators from DG Santé. And I would like also to say that the COVID-19 crisis has turned us in DG Santé into an even bigger consumer of research results than ever before. Santé is directly leading the efforts to address the COVID-19 crisis, coordinating control measures of member states, ensuring access to products and pharmaceuticals needed during the crisis through joint procurement, concluding advance purchase agreements for vaccines under development, and also producing political guidance for member states. The ECDC is preparing and updating risk assessments and publishing guidelines for handling the pandemic for member states. The European Medicines Agency is accelerating approval of relevant therapeutics and vaccines. All of this depends to a large degree on incoming research results, which are actively used immediately after they become known. Research questions stemming from practical problems have flown directly into additional calls under Horizon 2020. It was never so obvious what the term synergy actually means. Our ambition is to ensure that what works now quite well for short-term needs during crisis becomes more common practice also in the longer term. Horizon Europe will be the key producer of new health knowledge in the EU framework. Actually, there are several other EU funds and programs that will finance application of new health knowledge in our societies from different perspectives, such as social policy, digitalization of health systems, or regional development. Ideally, all such investment should be based on the latest available science, and input for new research should be derived from experience gained during practical implementation. All of this is easier said than done, and today we would really like your input also on how to shape Horizon Europe to improve synergies. So that was my message from DG Santé, and now I give the floor to Santiago from DG ECFIN.
Yeah, hello, my name is Santiago Calvo Ramos from DG ECFIN, and I'm a health systems analyst and an economist as well, and I work on assessing the fiscal sustainability of health systems. Well, the COVID-19 pandemic has taken the world by surprise, but a lot of the reasons that we can learn as health systems really emphasize research questions that we already knew about. So we already knew that public health matters. You know, prevention and stopping people from falling ill is the best treatment. And we need to think in terms of research about what are the best interventions that can have the most impact at the smallest cost. We already knew that primary care matters. You know, family doctors can really help patients before the conditions escalate and they require hospital care or further treatment. So what is the best way to organize and deliver primary care? How can we make sure that we invest enough and we invest on the right things? Then we already knew that technology matters, but the technological advances that we're seeing now in terms of COVID are massive. You know, types of vaccines that didn't exist 6 months ago are now being developed and are now being tested. And we need to know which technologies are the most efficient, which is the best way in which we can ensure that new technologies really mean that treatment for patients will actually be better and that outcomes will be better than they would otherwise have been, and at a cost that is as low as possible. And there's an area, as well as these three, which we already all knew about. There's really three areas. There's really a new area that we knew about, but this crisis has really emphasized how important it is. And that's flexibility and preparedness. We need to know, what does a flexible health system look like? What features does it have? How can we ensure that our systems perform well against the next crisis, which will by nature have different features to this crisis? So again, this is something where we need to think on what is the best way of doing this, and we need to progress our understanding. And I think in these four matters, research is key, because it can really advance our knowledge and help us be more prepared. So according to me, this would be the four main areas, and I'm very curious to hear which are the areas that you think are important. And yeah, what do you think about what are the best areas for research in the future? Okay, and now I hand over to Anna, who will tell you more from a DG research perspective.
Thank you very much, Santiago, and I'm very pleased to take over from you here, and I will use a couple of slides to guide you through the next part. But first, just for you, those of you who were connected this morning in the opening session, you may have heard our Director General from DG Research and Innovation, Ron-Erik Paquet, saying that an absolute key to success of whatever we do, that we have people engaged. And this is exactly why we organized the session in this way, as Stefan said earlier, that we want to listen to you primarily and not the other way around. So just set the scene with a few slides, and then we can get started. Just to zoom in on where we are in the Horizon Europe landscape. So it has three main pillars as building blocks: Pillar 1, Pillar 2, and Pillar 3. And there's a horizontal part as well: widening participation and strengthening the European research area. And this particular session zooms in on Pillar 2, global challenges and European industrial competitiveness, and on the cluster number 1, health. So this is where we are located in the landscape. And this co-design workshop is a continuation of the Horizon Europe strategic planning process for the period 2021 to 24, in order to define the key orientations for research and innovation investments with targeted impacts. It started already last year with a web survey, followed by last year's EU Research and Innovation Days, almost exactly 1 year ago. That was in order to develop the orientations towards the first strategic plan for Horizon Europe. And this year we continue the consultation process. So we just recently concluded the web survey again, and actually towards a more detailed aspects of what we're talking about here. So we're planning now, after the conclusion of these RNA days that are happening right now, to finalize the strategic plan that we do also together with the member states. And this also includes the more detailed cluster-specific plans. And this is why we are all gathered here in this session, to look particularly at the health cluster. And that will in turn help us later to develop the first work programs for the first 2 years of 2021 to 22. So just for you to be aware of what we're talking about here, and I'm going to present here very briefly the scope of the health cluster. Since this session aims at opening up the opportunity for you to sorry, I have to answer a question in the poll here that just popped in up in front of me, but that's done now, right? To answer a question that we have to you. So for you to be able to do that, just as a way of reminder that we have 6 targeted impacts in the health cluster. So this is all about staying healthy in a rapidly changing society. It's also about living and working in a health promoting environment. Obviously tackling diseases and reduce disease burden, but also ensuring access to innovative, sustainable and high quality healthcare, and also unlocking the full potential of new tools, technologies and digital solutions for a healthy society in order to do that. And all this depends on our ability to maintain an innovative, sustainable and globally competitive health-related industry. So this is the background, if you like, sort of context within the health cluster, within which you are very welcome to put forward your input. And we'll have a couple of questions for you that I will present later. But before I do that, just to say that I will not use my precious time here really to go over the many sorry, I'm a little bit distracted by the polling questions that come in front of me. Apologies for that. What I wanted to say to you, I'm not going to use my precious time to go over the many very important and impressive initiatives that we have taken in order to support research and innovation in response directly to the COVID crisis. But I will actually just mention very importantly 2 emergency calls for proposals that we've issued. And I will mention those because I think those are absolutely essentially important. So first, at the beginning of the crisis, we very quickly went out for an opportunity for scientists out there to address research proposals covering diagnostics, therapies, and vaccines to target COVID-19. And also support of those areas, clinical research. And then slightly later, a few months later, we came out with a second call that covered rapid response for rapid repurposing, I should say, for vital medical supplies, also medtech, digital tools, and artificial intelligence to improve surveillance and healthcare. Also setting up a pan-European cohorts, and very importantly, the behavioral, social, and economic impact of COVID-19, including on mental health. So we've also invited already existing projects that are funded in the past to actually slightly reorient their activities, wherever that made sense, of course, in order to target COVID-19. We've also notably created a much closer collaboration with member states in coordination and dialogue with member states regarding their own research funding on COVID-19. And we made absolute massive effort in fostering the open sharing of data and results. So scientists receiving now funds in these projects that are obliged to generously share amongst them. So against this background, I just move over to the questions that we actually would like you to focus on for the rest of the session, essentially. So we have identified 3 questions, and I think you need to think about them against the background of those 6 targeted impacts that I was presenting before. So really think broad and wide about here. So for each of these questions, and we will slowly go through them one by one, we are going to take 10 minutes approximately. And you will be invited to put comments in the chat box on those. And I'll show you slightly in a little moment how you're going to do that. So the 3 questions, and we'll repeat them later, are, and start with the first one here. What R&I research and innovation results are needed for achieving the targeted impact, and who will be able to immediately use these results? That's question 1. Question 2, how can health research and innovation in the short to medium term, we're talking about 2 to 5 years from now, support a continued response to COVID-19 or help in Europe's recovery? We're talking about repairing the economic and social damage, for example, brought about by this epidemic. And then thirdly, how much attention should be paid on cross-cutting aspects? And they can actually be many, but some of the most important things, I would say, are probably international regional cooperation, synergies with other European and national programs, gender equality and inclusiveness, social sciences and humanities, ethics and integrity, open sciences practices, education and training, dissemination and exploitation, market uptake and deployment, key enabling technologies, social innovation, and also strategic autonomy. So 10 minutes for each of these questions. So how do we operate in practice? Well, the polling you're seeing coming in, and I hope you've answered to that. And if you haven't done so, perhaps you can do that before you leave the session. That we would very much appreciate that. That's really about you, who you are. We're very interested to know who are the people and what are you representing if you're connected to the session. But we'll absolutely, of course, not make any connection between your identity and your interventions. That remains that remains no connection there. So in order to answer the 3 questions, as I said, you can do that through the corresponding chat box. And we are going to repeat the question in a so-called sticky note at the top of the chat box, so you can see it also there. But you will have the question exposed in front of you on the slide as well. Now, if you wish to suggest other questions to the audience, this is also possible. Although we don't see the main this session as a main forum for us answering questions to you, as I said before, that's been repeated now several times, but still, nevertheless, if you find that other questions merit to be put forward, you're very welcome to do so, but please then use the Q&A box for that. So with that, I think we can start with question number 1. And again, this is about what research and innovation results are needed for achieving the targeted impacts and who will be able to immediately use these results. And I can see here in the chat box, we have an intervention. Social determinants of health, like poverty and inequality, have to be thoroughly explored as a starting point to tackle these issues in non-pandemic scenarios. I think we heard also this morning in the opening session the absolute essential, let's say, importance, the crucial aspect of taking into consideration seriously equality and equal access to whatever results come out. We've seen also in the COVID pandemic striking, let's say, inequalities throughout Europe regarding access. I think poverty and inequality are absolutely cornerstone. You're so right about that. Thank you for raising that aspect. And we are, of course, fully aware of that. We're not ignorant of that in our planning, I should say also. But thank you very much. Inequality, poverty and inequality. Yes. What I will do in the end towards the end, we will all about the questions. We were going to summarize the main points, I should say. So, and now the question coming in here. Yes, we need a thorough knowledge about all aspects of novel coronavirus to be able to do anything about the pandemic, from molecular biology to environmental medicine and health IT. I think that's absolutely true. We don't know enough about the virus yet to fully understand the implications at the biological level, but also the impact on society. So this is absolutely right. So then we have a comment here. Oops, it's disappearing out of my site here. It's pouring in. Thank you very much. You're very active, and that's very much appreciated. Yeah. To tackle health challenges, we need to expand existing knowledge on biological mechanisms of disease as well as of healthy states. Without the comprehensive understanding of biological mechanisms that determine human health, anything that follows would hardly be effective or efficient. Absolutely. And this is so true. Also apart from the COVID crisis, but also with the COVID crisis, absolutely important. So mechanisms of disease, yes. We need citizens to be involved. So true. Through PPI in the definition of the research challenge, and we need them to fully understand the results. That will provide tangible impact. Indeed, and this is a way to more directly have a dialogue with the community before we go into calls on what are the specific needs. And that is a new tool that we are hoping to be able to develop in the future, indeed. So more collaborative research and innovation will be needed between academic and clinical researchers. There's still much disjoint between these in Ireland. I think it's not only in Ireland, if I may say so. I think this is very important. So this has always been a little bit of a difficult issue to bridge. And we have done many efforts in the past to reach out and trying to bridge this, and it's of course a prerequisite to. And I agree that it's a difficult one, and we need to progress on that one. And you have support there also. Without basic knowledge, there can be no impact on any kind. So we have support for basic research, we have support for translational research, clinical research, and the strong connection between them. We have support for understanding the biology and determinants of health. European unified standards of data. Absolutely. To progress, and as I mentioned, we ask our recipients of the specific COVID funding, if I may say so, to generously share the data amongst them and work together. And of course, we need to be able to do that efficiently and in a trustful way. So this is a way to, of course, leverage on the resources that we put into motion through the funding of the projects, to leverage much more and get much more out of that for everybody's good, and for also the speedy acceleration of research and innovation. Understand resilience factor and role of the immune system. Yes, immune system plays a strong role in most contexts, I would say, in terms of health. We need to learn from all countries. Do we have access to data from China? That I think I will park that question for later. That's a complicated one. In relation to Destination 3, which is about tackling diseases and reducing health burden, make sure that all COVID research and innovation funding and results will be connected to work on poverty-related and neglected diseases, the TB, HIV, and malaria, and make sure the surplus research and development funding that will be directed to these diseases of poverty to make sure we meet SDG and WHO targets. Okay, poverty-related diseases, yes, I agree. These are very important still today. Healthcare and allied health workers should be able to use results immediately. Yes, thank you very much for that one. We want to see a broader engagement in future research projects of, let's say, non-classical players to be directly engaged. And it is one way of engaging with the citizen is, of course, to consult and ask what they think. Another way is, of course, to make sure that they're inside our research projects. We have had engagement of patient organizations in research projects in the past, but we think also that we need to have a much broader and better represented, let's say, better representation of the civil society inside the research project, and that will take things forward much better. To achieve desired targeted impact will be of strategic importance of directly and fully involving in the work program all key players of top-class scientific excellence working in Europe, including international research organizations located in Europe. As demonstrated during the pandemic, this is essential to address and effectively tackle the major societal challenges, particularly in the health context. Yes, absolutely. We cannot give in on excellence. If we fund mediocre science, we get nowhere on impact. We need to stick to excellence as a prerequisite, and to make sure, of course, that this excellence is channeled in an appropriate way. And I think perhaps I've said it before, but this is where we need to improve. Supporting collaborative research with industry and citizen science, but not forgetting basic science too. Yes, there's a lot of support for basic science. We should not forget that we also have the European Research Council that covers everything in a bottom-up approach. But indeed, these programs are complementary and they need to talk to each other as well. We need to focus on research and innovation on screening programs, improvement in screening of cancers who got very delayed in the past months. So using artificial intelligence, this is absolutely true. I should say also that we have the mission on cancer. It's in a different session. And screening programs is one of the big priorities put forward there. I'm looking at the clock now. I'm coming to the end of my 10-minute session soon. We will sum up. We will look at all your comments here. I haven't been able to go down the whole list, but we'll make sure that in the conclusion of this the session that we try to cover the main points. And some things I see repeated very often here, and that means also that there's a lot of support for that. So from my side on question 1, I would like to conclude. So I can see that there are things that I did not at all mention that you have put forward, but simply time will not allow. And I would like to move over to question number 2. And that question is going to be moderated by Santiago. So over to you, Santiago.
Yes, hello, thank you. Okay, so this first question was really about, in the short run, what can research achieve? And what we would like to know with the second question, which I think already some of the answers to the first question touched upon, so I've been taking some notes. We want to know, how can health research and investment on the short to medium term, so up to 2 to 5 years from now, support the continued response to COVID and help in Europe's recovery? And I think that answers that also, are also a bit about the longer term pandemic preparedness, etc., are also welcome. Any ideas that you have? Okay, so And I think that actually should be possible to ask some of you to actually speak and say within 1 minute whatever ideas that you. Oh, okay. So, Anna is making me signs that note. Okay, so then I will summarize as she has done the responses that we get. Okay, so one of the first. Okay, so I have to see which are responses to the last one, which are responses to the first one. I mean, I can see here from Regina Hanke about the One Health approach, and so to take into account climate change, and I think that's very important in the sense we can avoid future pandemics by preventing the causes for pandemics. So it's almost like a prevention approach to pandemics before they arise. Then also Jens Jager here talks about developing and inventing digital tools to help us cope with the pandemic. And again, yeah, innovation, as I said, is one of the big issues. And yeah, pathogen discovery, I think that links also again to the preparedness that we spoke about. So part of it is actually being able to catch new pathogens when they arise. And I think that's very important. That's something that is a very good point. This goes very fast. Then François Charby talks about capitalizing on the digital shift that COVID has accelerated, but taking care of basically data governance issues. And I think that's a very important point as well. Then Martin Telefond talks about coordination and source data analysis across national level. I think that that's an angle that we have all realized that is very important, and that is very much been looked at the moment. But yeah, I think that's a very valid point. Then healthy living, image-guided interventions, acute complex healthcare, multidisciplinary interprofessional education. So a range of interventions ranging from what we would call prevention to actually the organization of healthcare, healthcare systems. Then Gemma Garcia Zato talks about protocols to ensure attention to COVID-19 patients doesn't block health systems. That's something that appeared as well in the questions to the first block, the first question, basically about how to deal with healthcare for other conditions while at the same time dealing with COVID. Then Ruth Schmid, understand the immune response, how to build as broad an immunity in the population as possible, and that again goes into COVID research in the medium term, which is also quite interesting. And again, Marta Agostinho highlights similar issues in terms of how small-scale research infrastructures showed the key to cope with diagnosis and development challenges in COVID-19. Amanda Ozin talks about the health communication science and how to communicate to prevent and mitigate pandemics. This is something we're seeing very much here in Europe, whereas in Asia, they already have an established protocols and established communication habits, basically from the last pandemic that they had over there. And I think, yeah, it's an issue that is very important as well. I would class it as coming under public health and prevention, but yeah, health communication is very important as well. Focus on data managing and sharing for a coordinated response from Ashley Byrne. Yeah, that's an issue that as someone who works with COVID data on a day-to-day basis, I fully share, and I think that there have been issues around that very, very much. Again, Jens Jager bringing us a similar issue on creating a European health data space where we can ensure that data is available and is shared, but at the same time with good data governance that prevents any privacy concerns, etc., etc. Mette Atipay-Craggs raises something that is interesting, which is mental health services as a crucial part of the response. And again, yeah, I think that links a little bit to some of the conditions that are forgotten about in the COVID pandemic because they're not COVID, but they are related, and also a little bit to prevention. Yeah, exactly. Something that was raised before here by an anonymous correspondent is basically about long COVID and the late medical health effects of COVID-19. This is something that over the next 2 to 3 years will become very important, needs to be researched. At the moment, we have lots of anecdotes coming out, but we need to have data on that. So that's a very important issue that can only be done in the longer run. Then how from Jens Jager again on how research infrastructures such as genetic sequencing facilities and others proved very valuable during the pandemic for diagnostics. For example, now lately for diagnosing reinfections, and it's an interesting area as well. Then and then Mathilde Olivier has an interesting point on tackling chronic diseases, which are the big killers and which we have forgotten in the middle of the COVID emergency, which is something that has already been mentioned. Let me see what else are there that is new. So this, for example, here a mention of the consideration of the pandemic state of non-European countries and surrounding countries, which is very important because, of course, there can be transmission of infection, etc., etc., and also you're always interested in your neighbors being in a good position, etc., etc. So I think that's very relevant, and for the EU, that's something that is very important. Again, a point from Angelos Kembris on communication. For Marta Agostino on better coordination. From Peter de Koning on differences in virus spread between countries, continents, and what we can learn from this. So looking back at the COVID pandemic over the next 2-3 years and trying to learn from it. That's very important as well. And again, Joana Camilo here with close monitoring and impact assessment of implemented policy and healthcare measures with benchmarking. So trying to see what worked and what didn't work. And for the future, promotion of preventive behaviors and mitigating fake news, which has been a real problem in this pandemic. Again, from Regina Hanke on sharing data. The EC having leverage over national COVID-19 projects. Although, of course, here we're talking more about research than about policy itself, but it's a fair point. Again, different uses of benchmarking of responses between countries. Although there, I think that we need to realize, this links again with preparedness for the new pathogens. We will learn a lot by examining the old, the COVID-19 crisis in the future, but we always need to be prepared for the fact that the new crisis may have completely different pathogenesis, and so may affect people in a completely different way and may impose different types of pressure on health systems than this one has. So I think that's where flexibility is very important. And then Sonia Ryland, understanding the role of children in the chain of infection. That is a very, very important point at the moment. Although, of course, it may be a bit more for in the short run for question 1, but also have implications for question 2, because at the moment we need to understand as much as we can. But in the future, of course, we will have the benefit of hindsight, and we will be able to understand it more deeply. Okay, so I am coming as well to the end of my 10 minutes, and I will now hand over to Stefan, who will discuss the third question, and I will try to summarize this for the end of the session. Thank you very much.
Yes, thank you, Santiago. Okay, so now we come to question number 3. So it would be good if you could actually post it, but maybe in the meantime, I could comment maybe a bit on the comments which we have seen so far. I noted that actually many of the comments actually are very much at the borderline between public health policies and research on the one hand. And one important element of the comments was also to strengthen access to data and information, and also to strengthen cross-border collaboration and mutual learning. And from a DG Sante perspective, indeed, we consider this also very important. And I think that is a very important conclusion for us, that you agree with this approach. Okay, now we can see on the slides the third question. So the third question is, how much attention should be paid on cross-cutting aspects, and which ones in particular? That's obviously also quite important. So we are thinking there about international and regional cooperation, synergies with other European and national programs, gender equality and inclusiveness, social sciences and humanities, ethics and integrity, regulatory issues, open sciences practices, education and training, dissemination and exploitation, market uptake and deployment, key enabling technologies, social innovation, and strategic autonomy. Yes, so also there we are looking forward to your comments. Yes, and we see already some. Yeah, invest in European-based manufacturing facilities for vaccines. Yes, that's for question 3. E.g. by use of European structural and cohesion funds. Indeed, that's quite important also from our perspective. We would like to use all the available funds in the same sort of coherent manner with commonly agreed objectives. Indeed, and European health security should be considered in a similar strategic way as European defense issues. Indeed, that is clearly something that is also on our minds, that the importance of health security in general needs to be considered in a different way than before. Yes, then again, we have the availability of quality health data. Indeed, I think that is one of the key conclusions of this session, that there should be a better availability of health data. Obviously, we have to respect the general data protection directive while doing this, and that is really a challenge. But there will be a new action financed under the health program to actually do just that. Yes, and one thing I pick is also open sciences practices. Indeed, one of the key elements we want to achieve is that research results are available immediately to those who can use them. And obviously, open science is an important element to achieve that. And again, international and regional cooperation. Synergies with other EU and national programs, indeed, we also completely agree, and we appreciate if this is actually, this feeling and this ambition is shared by you. Yeah, and One Health, indeed, we can see with COVID-19 that there is cross-sector collaboration is absolutely necessary, and that's a key element to address this crisis. And again, we had this question of equality, gender equality, and indeed, both the pandemic had different effects on different parts of society, and actually also our measures are having different effects on different parts of society, and that needs to be absolutely looked at. In crisis, these aspects are often forgotten, but they are most important for impact. Gender, absolutely, that's completely right. So there we also agree. And also the international coordinated regulations, that's indeed very important, even beyond Europe, even though we must note that there is a political problem with that. But the Commission is leading also here, for example, trying to work towards availability of vaccines all over the world and not just in Europe. And there's another important point I find. Behavioral sciences are key to the perception and uptake of scientific advances, because we see also a lot of science skepticism, I would say, these days, and that also needs to be addressed. Then we have here a point, regulatory coordination to speed up global acceptance of new vaccines and therapeutics. That is indeed absolutely important. If you want global access of vaccines, we also need global coordination of regulatory aspects, and we are actually working on that. And international and regional cooperation, open sciences practices, education and training. Indeed, that's a good summary. You're really flooding us with your comments, so thank you very much. That will be very interesting. We will need some time to analyze all of this in the end in detail, and it will actually be difficult to summarize. But again, thank you very much. And here we have a point also interesting. A coordinated EC dissemination effort would be great and bring about best impact, again, consolidate national efforts. And indeed, such efforts are already ongoing, trying to have an overview of what studies are relevant and can be accessed. But there are so many that this is a real challenge at the moment. But we completely agree that this effort would be useful. And another interesting point I see, how cross-cutting aspects are implemented is also crucial. Do not burden individual researchers or projects with issues that need an institutional or broader approach. Support strong institutions and regional level action. Indeed, we do not want to burden researchers. They should be doing research. But it is also clear that there needs to be a good flow of information, basically in real time, from the scientists to those who use the results, and how to organize this without placing a too big burden on the researchers is again a challenge. We have seen also that. Yes, and another important point, actually for question 2, we did not mention the importance of accepted and validated diagnostic tools, harmonized diagnostic approaches. Sorry for not mentioning earlier. That is indeed a very important element, and our Joint Research Center tries to address this. But this is very difficult when so many different tools are developed at the same time and all need to go through the same bottleneck of harmonization and coordination and regulatory approval. But point is fully taken. Yes, thank you again. There's really so much coming in. Yeah, it will be a real pleasure to analyze that in the end. Yes, so we have now, it's 16:46, so we have another 4 minutes to provide answers to question 3 before we then conclude this session. So if there's still something, please type it in. You still have a couple of minutes. Yes, and we have another point that we completely agree with, bridging between tech research and clinical research and then translating research into daily practice. That is actually one of the main focuses of our attention these days in DG Santé, actually translating clinical results, scientific results into clinical practice. Another interesting point. This is real fun, I have to say. Opening up healthcare throughout Europe, like for European reference networks. So thank you for mentioning the European reference networks, which actually embody already several of the principles which have very often been mentioned before. And indeed, it might be good to see whether this principle, which is now used only for rare diseases, could be expanded also to other diseases wherever European collaboration on clinical care and research makes sense. Also there we agree. We need a cost action on COVID-19. Now that's really for our DG RTD colleagues to reply to, I'd say, but it's a very practical proposal. Yes, you have still 3 minutes if you have further ideas. Yes, and again, I can already tell you my preliminary conclusion. A lot is really about interaction between research and clinical practice and practical application with measures. Yes, and also evaluation of economic costs. Indeed, it is very important also to know what kind of measures will have what kind of health effects and what kind of economic effects, and you need to balance these. And that's an important part of the overall assessment of what measures to take. COVID and cost. Shouldn't we first have an overview of what research is going on? Indeed, indeed, and a lot of research is going on. So it's difficult to have an overview. Are there any specific action points in reducing the barrier to market entry for innovative health technologies? Yes, that's an important point. I would just refer to the proposal on HTA, on health technology assessment, that was put forward by the Commission last year. And another important point, again, about international cooperation, why some countries are very successful fighting COVID, and can that be copied? And in DG Sante, actually learning from other member states is really a key part of our work these days. So we also agree completely with that. And international cooperation to increase Europe's competitiveness and global impact. That's indeed also very important and can only be achieved by more cooperation, we think. Yes, now it's 16:50, so that basically time is up also now for our third question. And we can essentially come to the conclusions.
So are you handing over to me?
So let me, yes, indeed.
Good. Okay, good. Thank you very much, Stefan. This is so exciting. I don't want this to stop. So yes, trying to summarize the input on question 1, which was about, the question was what research and innovation results are needed for achieving a targeted impact, and who will be able to immediately use these results. So when I looked at this and tried to sort of sort and group the various inputs, I could see roughly 3 categories. One is really the immediate COVID biology aspects, if I may say so. And the second is the wider aspects of environmental aspects around the COVID crisis. And then the third is how do we do science? So if I go more specifically then on the first point regarding the biology, yes, understanding biology of the coronavirus and the disease, the impact of the disease on us human beings, also in the longer term. There's many unknowns that we need to understand a lot more about that. We also need to understand more broadly the basic mechanisms of disease in general, and we should not forget the role of biomarkers. Diagnosis is absolutely important in this context also, and we should make an effort on developing better in vitro models. to be able to pursue that. So and on the vaccine side, obviously more research on COVID vaccines, but also about the role of the of our immune system, immunity to COVID, but also whether vaccines can actually generate a proper longer-term immune protection. So this is on the, let's say, immediate biological side of the disease itself and the impact. And the second group would be then the wider perspective. And there was a lot of input about One Health and the importance of understanding the risk of new pandemics breaking out in the future. We need to preserve biodiversity, and also do work on our true preparedness for future new pandemics. We need also to look at more general how we stay healthy. This is sort of the mission anyway of our, let's say, activities before COVID, I would say, the mission of staying healthy and preventing disease from appearing in the first place. That is very important. We in this, let's say, bracket, I would also put the comment on connecting the disease of COVID-19 to the poverty-related diseases that was mentioned as well. And so that was a wider perspective. And then third, how to conduct the research. Well, there was a lot of support for basic research. We should not forget the importance of funding basic research, and it needs to be excellent, of course. We need to support collaboration. We need to make it easier for scientists to effectively exchange data through standardized data and to provide open source data. International collaboration in this field is absolutely crucial, and that needs to be an effective collaboration. And not to be forgotten is to properly involve patients and citizens in the dialogue, but also in the project. We need to look particularly also at the issue of poverty and equality across Europe, and take into consideration seriously gender and sex aspects, as well as a wider societal context. So bridging throughout the various disciplines, from basic to clinical to totally applied, and the wider community is very important in order to get the results out there faster. And not to forget also behavioral research coupled with good communication. So if I may just conclude in one word, when I listen to this whole debate, I think it's too bad that you can't talk, but we have listened to you in your chat. I see a fantastic opportunity for synergies between the Horizon Europe program and, for example, the Santé Future Health program. So we will look closer into that. And with that, I close from my side. And perhaps I'll hand over then to Santiago, if you would like to sum up your part.
Yes, hello, thank you. Okay, so on question 2, we have some overlaps, of course, with question 1. Question 2 is more about the medium-term research results that we would like to see in the next 2 to 3 years. And I think they can be summarized as belonging to 3 main groups. The first one is to learn more about COVID. So to impact assess COVID measures, which are effective, which are less effective, and I mean particularly the non-pharmaceutical, non-medical interventions such as wearing masks, etc., etc. Then understanding COVID better in the cases of long COVID, in the cases of people that have long-term effects of COVID in children. Then data sharing, which is a bit of a common theme because it appears almost everywhere, but to understand better what happened. And then the use of harmonized diagnostic tools that can be used to actually detect COVID better. And then the second part, which is to learn about preventing the next COVID. And like in the first question, there's an environmental aspect in terms of preventing the pathogens from arising in the first place. Then you have pathogen discovery. Once the pathogens have arisen, once the diseases are there, to learn to detect them and to learn to neutralize them as quickly as possible. And then to learn what does a flexible and prepared system look like. And one of the interventions that we have to also look at is effective communication, actually, as a very important preventive measure that in which we have probably fallen a bit short in this crisis. And then finally, there was a third group that was learning about things that are not COVID, and this includes other conditions that have been forgotten about or have been postponed, where care has been postponed. Also mental health, long-term conditions. And so to look at the things that we may have been forgetting in all of this rush of thinking about COVID. So that would be all for question 2. Thank you. And I now hand over to Stefan.
Yes, thank you very much, Santiago. So for question 3, we also really had a lot. I just try to summarize very quickly. Key enabling technologies are key to success. Then availability of quality health data and open science would accelerate progress. International and regional cooperation was mentioned also quite often, and also with EU and other national programs. Gender equality, both for patients and effects of pandemic management on society. Importance of education and training, building capacity. Working closely with social sciences and humanities, because COVID-19 is impacting every corner of society. Then behavioral sciences to address mistrust in science, regulatory issues, including international coordinated regulations. Yes, we are completely in favor. Importance of ethics and integrity, education and training, health literacy, better EC dissemination to improve impact, build on cross-cutting aspects in the program, but not overburdening the researchers. Bridging tech research with clinical research, then translate and implement results, opening up healthcare throughout Europe, like for European reference networks, evaluation of costs as well, reducing barriers to market entry for innovative health technologies, and spreading best successful practices of member states. So that's my short summary. Then there have also been questions in the Q&A part. One was more common, very nice session, introductory remarks and group discussions. Thank you. We thank you, actually, because you were doing the work and we were just asking the questions. Where will the discussion results be published? Well, obviously, the first purpose of your results was to influence our thinking, which I think they will do, and that's how they achieve impact. I don't know what the plans are to publish them, actually. Why focus on COVID-19? Well, actually, this session is for short-term actions that could be done to address COVID-19, as I tried to explain in the beginning. There will be another session which will focus on the rest, on the longer-term other issues. Yeah, so that was basically our summaries. And actually, it is now 5 o'clock, so I can say thank you very much also on behalf of all the other moderators. I can thank all those who are helping preparing the sessions. I thank you for this really, this multitude of input. We are very grateful for that. So thank you again, and we wish you a very nice day.
Thank you.
So